Welcome to episode number 2, 1 year of the pandemic. I'm your host, John Lund. As we rejoin our look at COVID's impact on London, Ontario, students are feeling the effects.
It's like the year was erased. It didn't exist. Students know that feeling. Their classes were shut down before the March break, and each time there's a date to reopen, it passes with a new date coming. Classes go online. Teacher Stacy.
Normally I can see if students aren't understanding something or if they have a question or whatever it is because we have a reciprocal relationship. So much of it is body language. I mean, they're teenagers. We don't have that now. We've developed a mantra, though. Everything we think and do and say and plan is going to include the phrase, because we're in a pandemic. We're in survival mode. We're going to do what we can do the best we can and do it together because we're in a pandemic. There's nothing more important than your health and well-being right now, and that trumps everything else.
Graduation plans, proms, and the bittersweet farewell to high school tossed aside.
It's the end of a part of their life, and they don't get to have it. Everything that's a milestone is just being pulled away from them. People say, oh, it's just the prom. It's not the prom. It's what it symbolizes and what it means. They've had everything ripped away. On the other side of it, when we get through this, now look at what these kids are walking into after what they've just come from. They're going to be walking into a thing that's scary and uncertain in the first place, post-secondary education or the workforce or whatever their next step is. And it's added to what they just came through. That's traumatic.
Trauma comes in different places and different ways for all of us. But during the pandemic, it rises and overtakes the places that are supposed to care for our elderly. 1 month into the pandemic, the elderly account for about half of Ontario COVID-19 deaths. 15 residents of Hagersville's Ann Place die by April 13th. A healthcare worker there.
I'm scared. It's exhausting. And some of the girls are working 10, 11, or 12 days in a row.
It doesn't take long for the virus to spread through crowded bunkhouses of southwestern Ontario's migrant workers.
For the past couple of weeks, we've been trying to sound the alarm about the spread of pandemics on farms. This is something that was preventable.
Ontario Federation of Agriculture.
You know, we've been saying all along, it's not a case of if we have an outbreak on a farm operation, it's when. Was it bound to happen? Yeah, I wish it didn't, but it's no different than people who work in a grocery store, hospital, or old age home. There's physical distancing, but because of the nature of the work, there's a risk.
In the first weeks of the pandemic, the medical community has to move quickly. Assessment centers to test for COVID-19 spring up. A health team spokesperson.
What we're finding is that most people are looking understandably for reassurance. They're looking to understand whether they're at risk, what that risk is, and what's going on. There's been so much changing so quickly that I understand how hard it is for folks to know what they need to do.
London's hospitals rushed to process COVID-19 tests, bringing in expensive equipment and building capacity in mere weeks.
On March 19, we did our first COVID-19 lab test. We were running about 45 tests a day. Now we're up to 130 tests a day. Before this, we were sending samples out to the provincial labs, which would take 5 to 7 days to turn around. We're doing it in less than 24 hours now.
Western University researchers get nearly $1 million from the federal government to study the new virus and help develop a vaccine.
We're going full steam ahead. There will be a rebound again that typically happens with this kind of viral pandemic. Hopefully when that second wave comes, we'll be prepared.
Family doctors restrict face-to-face visits in an effort to control the spread of the virus, but keep offices open for essential operations in part to keep pressure off emergency rooms.
This is one of the first times in our careers we are all concerned for our family's well-being. Every time I see a patient, even in full protection and taking precautions, I am exposing myself theoretically to COVID-19 and exposing my family when I get home. It's never been such an everyday, I can become sick from my patients type of issue.
In late March, London's hospitals are forced to ration face masks as surging global demand for personal protective equipment leads to shortages. The hospitals face work stoppages from nurses as frustrations rise. Nurses Union spokesperson.
There's not a single nurse here that's not going to give 110% for their patients, but they want to be treated like any other worker. You wouldn't go to a construction site without a hard hat. You wouldn't ask a firefighter to go into a fire without their equipment. It's terrible.
Efforts to provide frontline hospital workers with gloves, masks, and gowns divert the same protective gear needed for thousands of other workers helping vulnerable children and adults.
It's clear to me that everyone's supply count is low. Our concern is the safety of the clients and the frontline workers. Knowing that there's a huge need across the entire system, our role has been to ensure that home and community care is not forgotten as a very significant provider during this pandemic situation.
Patients who recover from the virus tell their stories.
I'm middle-aged, I'm 56 and strong, and I thought this virus should just bounce right off me. But this thing just slams older people. We've all grown up with the flu, and yes, some people die every year, but this is a virus, has a weird twist to it, and people have got to take it very seriously. People need to respect their community and the other people around them, and the professional healthcare workers. Trust the doctors.
The harsh reality of COVID-19 comes home on March 27th. 74-year-old Martin of Strathroy dies in hospital after returning from a trip to Portugal with his wife. His wife remembers speaking to her husband before he died in intensive care at University Hospital.
They did put their phone next to his ear, and I did talk to him and said all the wonderful things I could think about, that he was a great dad and we all loved him. But at the same time, I didn't get to hear his voice back.
But amidst the death and fear and uncertainty, we learn to adjust and cope. We learn to enjoy the simple things and learn to mark milestones in different ways. The Shamrock Hunt to safely celebrate St. Patrick's Day in Old South.
I think there's a good possibility we'll eventually be stuck at home all the time, which would be terrible. But for right now, we're still able to go for a walk, so this kind of just gave us something else to look for on our walk. It also kind of gives us that sense of community. People are reaching out in their own way.
In Wortley Village, one family throws a drive-by birthday party.
I invited all the friends and family to do the parade. Nobody gets out of the car and it's all at safe social distance. I think she's going to be thrilled. She's turning 8 years old.
The London Health Sciences Foundation is inundated with offers of help, from hotel rooms and coffee and food for frontline workers to face masks from businesses and individuals. With its campus shut down, Fanshawe College's respiratory therapy program trucks the 11 ventilators it uses to teach students to London Health Sciences Centre.
We thought this is a great way for our program, our faculty, our college, to support our community with a potential local crisis. I've worked in healthcare many years, and I understand that this is such a vital resource. Ultimately, we're going to need them back at some point, but we're not thinking about that right now. This is about the greater good and making sure that we're doing whatever we can to help.
Windermere Manor repurposes to house healthcare workers afraid of returning home.
It's for free. We can't ask people for money at a time like this. Healthcare workers are putting their lives at risk. Everyone's stepping up.
Londoners begin efforts to collect protective gear for healthcare workers across the city. 15-year-old Callum begins producing face shields to donate to frontline workers. Meanwhile, London mindfulness coach Diane offers free workshops on meditation and fear reduction in an effort to support people struggling with stress and anxiety amid the COVID-19 pandemic.
I can't think of a better time than now to increase our self-care and to learn powerful techniques to learn peace amid the storm.
St. John Ambulance Therapy Dog program harnesses the power of technology, using Zoom and FaceTime to do virtual visits with clients across the city amid the pandemic. Isolated and worried as many of us are, we still think of others less fortunate. The London Food Bank's annual spring food drive.
This response is happening because of the pandemic we're in. There's totally more empathy in terms of food insecurity. At first we saw an increase in food donations, then we saw a big influx of cash donations.
The shutdown inspires people to turn to home and family comforts. People turn to baking and cooking like never before, and stores run out of baking supplies. In an attempt to boost the spirits of his team, a London ER doctor designs COVID-19 dress socks and gives them to his colleagues. The COVID Warrior socks later go up for sale with the help of a local formal wear outlet.
It started out on a whim. I thought, it's silly, but it's something. This has been an extraordinarily challenging time, so I was just trying to think of ways to let the team know that what they were doing is important.
A London restaurant shares some of its tips with those on the front lines.
When we started our delivery system, we didn't have a tip section on the website. We felt that every order was beyond generous, and we felt uncomfortable asking for tips. And we thought, maybe we should have tips, and we'll take that money and we'll use it to help feed frontline workers once a week. So that's what we did.
The annual Big Bike Giveaway starts offering free bikes to lower-income essential workers to get to their jobs.
We don't have masks or gloves or money to give other people, but we've got a warehouse full of bikes. Sometimes you just have to do what you can to improve the community.
We make it through the first 6 weeks together. London epidemiologist David.
What you can see in these numbers is social distancing is working. It has saved lives. There are people alive now who would have been dead if we hadn't done it.
But the pandemic shows many social disparities. As one social meme that circulates states, we are in the same storm, but not the same boat. Some of us ride the storm out in yachts, some in leaky rafts.
People are hungry. People are cold. I think there's a bit of hopelessness, a bit of desperation, not being able to access different services. There are a lot of people who are hidden homeless, who are doing couch surfing, sleeping in stairwells, or crashing in hallways. Their stairwells are locked. People are kicking their long-term guests out of their apartment. So all those people who were a little bit sheltered are now actually sleeping on the street.
There's enough toilet paper for everyone now. Instead, freezers are in high demand for those who can afford them and afford to buy in bulk. Cottage owners head to their safe havens to escape the city during lockdown. Some people begin to chafe against the rules and how police and other authorities are reinforcing them. The Canadian Civil Liberties Association says some police forces and local governments are abusing their power. By late April, the Church of God in Aylmer and local police appear headed for a showdown over the church's pledge to continue holding drive-in services during the pandemic. The church eventually wins this battle, a foreshadow of what is to come months later. London lawyer.
I do not see how keeping people from sitting in cars with rolled-up windows is a measure that is carefully designed to achieve the objective of limiting the spread of COVID-19. Preventing such gatherings while allowing people to park in grocery store parking lots and line up outside with poorly enforced social distancing restrictions and no physical barriers, such as rolled-up car windows between them, seems arbitrary, unfair, and based on irrational considerations.
That concludes episode 2 of 1 Year of the Pandemic. Please join us again as we unwrap the year of COVID in London, Ontario. 1 Year of the Pandemic is a production of the London Free Press, produced at the Digital Creative Arts Centre. I'm John Lund. 1 Year of the Pandemic is a production of the London Free Press. All rights reserved.
Maybe I could be the one to console her.